Hello, my name is Dr. Sabine Zenker. I'm dermatologist in Munich, Germany, and I'm showing you today the use of Radiesse from Biomedical as an injectable filler. So 30% of Radiesse is calcium hydroxyapatite particles and the rest is gel. This gel is going to fade and dissolve after 3 to 4 months, and the particles are going to stimulate the own body tissue to regenerate collagen. Radiesse comes in 1.3 syringe and 0.3 syringes for touch-up treatments with steroid needles, and if you want to, the adapter to put in the lidocaine for your injection. We're going to treat the nasolabial fold with a triangular on the upper end and the marionette lines on the lower. If you look on the anatomy, the nasolabial folds is generated by a loss of elasticity and sagging of the upper or of the middle third of the mid face, and it results in the triangular hair and then the lines here, and sometimes a little sagging around the marionette folds. And the target is now to fill up the triangular on the top, a little on the length here, and to lift up a little bit the marionette line. I'm starting with the fanning technique. I'm going with the 27 gauge needle in a 45 angle to the skin into the deep dermis, lift a little bit up and start with the injection. I apply 0.05 in each direction, next advancing in the fanning technique and applying tiny little dosage while retracting the needle, and then the next step, and that's it. In the next session I do with the same technique one last injection in the upper third of the triangle. While retracting the needle I apply 0.1 cc. The next technique is the serial puncture technique. I go in the 45 angle in the skin, advance the needle, and while retracting the top of the syringe, I'm injecting 0.05 per injection point. This is a technique to augment the nasolabial fold to give back the loss of volume caused by aging. Step by step. In that case, I would like to put a little bit more in a second thread to get an optimal aesthetic result. Always placing the material while retracting the needle. So far I just injected 0.4 cc. Next step is to treat the marionette lines. Here I go approximately 1 centimeter down from the angle of the mouth, the same direction into the skin, and while retracting I place tiny little dosage of the material. With the same injection point I go in the fanning technique, always while placing the material while retracting the needle. Immediately after the placement of the material you should do a massage. I like to apply some cream to smoothen the area open your mouth, and then I'm just touching, molding the area. It's better than massage, I think, because massage is something very different. And then that's it. On the other side, I'm showing the linear threading method. I start with the fanning technique on the upper angle of the nasal label fold, go in the 45 angle into the deep of the dermis, go a little bit, lift a little bit the tissue up to verify that you're in the right layer of the dermis, and then inject while retracting the needle. Just one injection point up, and a third time really up to the upper third of the angle. And then in the linear threading technique, which means go into the deep dermis with the 45-degree angle to the deep dermis, up, and then with just one injection point, in this case in 3 directions, to the deep dermis. That's it. And just another one injection point, and always approximately 0.5 cc to augment the whole area in a 3-dimensional way. And probably last one here, sorry. Here I just need one direction to fill up. Could you please advance your hand to show the result? I would like to just do one micro puncture here. You have to fill what you see. Always go in where you want to have an augmentation of volume, where you want to replace the lost volume. So now the last thing is to restore the loss of volume in the left marionette line with the fanning technique. I go approximately 1 centimeter down from the angle in the 45-degree down in the deep dermis, and inject just 0.05, in this case in 3 directions. Don't overcorrect. Don't go too high, too superficially, and that's it. Next technique is the threading technique to do an eyebrow lift. We place the needle on the lateral point of the eyebrow. I go very deep on the periosteum on the bone, advance the needle to the uppermost part or point of the eyebrow, and go on the bone in the threading technique. I place a thread of radiesse very deeply on the bone. Therefore, I'm using less than 0.1. Next, I advance a little bit on the periosteum, and then a thread while retracting the needle on the periosteum. And the third point is 1 centimeter from the highest point of the eyebrow to the bone, advance a little bit and do a thread, not a bolus, but a thread deeply on the bone. Can you see the difference of the two sides? Other side, place the needle in the at the end of the eyebrow, in a 45 angle, go to the bone, advance the needle to the highest part of the eyebrow and place the material in the thread over the bone. Don't go in the orbital region, just on the bone. And while retracting the needle, place the material not more than 0.05 per injection point. A next one on the periosteum, and then advance a little bit, and then a thread, not a bolus, and stop well before you come out with the needle of the skin. For this therapy I used 0.2 in overall Radiesse to do that eyebrow lift. We treat the vermilion border with Radiesse. We respect the anatomical pathway. We don't inject in the mucosa, just on the vermilion border. Therefore, I want to augment the area from here to here, because she has a very nice anatomy in the middle part. And therefore, I would like to please you to open your mouth. I take the lips in my hands, go in the 45 angle to the vermilion border and place a thread in between the lips in my hands. Tiny little dosage. That's it. And the second one, needle downside. I feel the material between my fingers, and that's it. Third injection just on the border. Oops. That's to show the difference between the treated area and the non-treated right side. I just did 3 injections from here to here, and I used 0.2 cc of Radiesse. Now I'm treating the other side. I'm taking the lips in my hands to know where I am, to 45 angle, advance the needle in the vermilion border, and I take the lips in my hands, and while retracting the needle I inject 0.5 in the whole, on the whole way. And the second injection just not too far to the center of the lip, because she has a nice anatomy there. Practically no bleeding, an immediate volumizing effect, and this time I think it's enough, and it was just 0.05 cc from the Radiesse. And last but not least, we're doing a little molding after the injection, just to verify whether the product is rightly placed. Now with much pressure, just follow the way you did the injection and mold it very gently. And that's it.